you guys have hearing aids, what type of things that you guys can do to kind of maximize what you've got currently as well. And then we'll kind of go into some of that new stuff so you guys are familiar with what's out there. So let me get my screen presented here. I swear the lawnmower guys know when I'm doing stuff like this.
Oh, I know. Every time our agent's
It's
next
the
to
neighbors, but I've got a noise canceling mic, so you guys probably don't have to hear it. So lucky you.
our Abrams office is next to Sherwin-Williams. So
Oh,
like we have a soundproof booth, so it is totally fine. But oh my gosh, like in the middle, boom, 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 closing the paint cans.
all right. Let me see here.
Oh, jeez.
Mm-hmm.
So there we go. So you guys should be able to see my screen now.
Yep. Thumbs
Perfect.
up if you can see a screen.
And I'm going to turn on their sound as well because I've got some videos in here, so I want to make sure you guys can hear those. Okay, so like Dr. Guinea said, my name is Marc Gracia. I am an audiologist. So I am a native North Texan. I was born and raised in Fort Worth. I went to Pascal High School, so I did not move too far away from the area, but was in clinic for a little over a decade, practicing in the area, and just transitioned probably about 5 years ago now to the manufacturer side, just for a change of pace and to have some different stuff I was focusing on. So thanks again for coming, and thanks for listening. And like I said, if you've got questions, please let me know. Let me see if I can get this thing to advance now. Maybe. There we go. So I work for Oticon, which is one of the major manufacturers of hearing instruments that's out there. I want to just kind of briefly talk about the origins of the company because I think it's pretty unique. So Oticon actually started with a love story. So there was a Danish businessman. His name was Hans de Mott. He is here on the left. I don't know why everyone at the time period seemed to just have the most wonderful smiles in their photos. They had to look so serious, but he is there on the left. His wife Camilla is on the right. And he actually, this whole story starts with him traveling to England in 1903. The reason he was doing that, there was a coronation going on, and there was a revolutionary new type of hearing technology that was in the news and the papers. So that kind of piqued his interest. And it piqued his interest because his wife, Camilla, had hearing loss. So not 100% sure what type of hearing loss it is. I think it was otosclerosis, but we'll talk a little bit about what that means in just a bit. But that's why he went there. So he went over there in 1903. He ends up getting his hands on a prototype for this hearing technology, brings it back to Denmark, and it was so life-changing, which is where we get our tagline, and just so profound for his relationship with his wife that inspires him to develop these technologies and to start a company to spread, the joy and the gift of hearing that he's experienced and just being able to um, communicate with a significant other without straining. So I think it's a pretty neat story. And we fast forward to today, and the company is run by a foundation that he set up, and we donate hearing instruments all over the world. There was just a recent mission trip to Guatemala that lots of cool folks that we got to meet and fit with different technologies. So. One of the other things that makes us unique, in addition to having kind of a unique origin story, is this idea around research. To me, Oticon is almost a company that is a research company that just happens to make hearing instruments. We are the only hearing aid manufacturer company that has an independent research facility like this, a standalone research facility that is used proactively in our process. So these guys, and we'll watch a video on it later, but these guys actually have so many different disciplines and expertise under their roof, and they sit together and kind of think, hey, how does the brain use sound, and how do we capture that information and that research and use that to guide how we want to develop technologies. So it's not where the engineers come over and they go, hey, we can create this, so let's verify it on the back end. It's a much more active approach, proactive approach of, hey, this is what we know about speech and hearing. This is what we know about how the brain uses sound, and how do we best encapsulate those ideas into technology that's going to benefit the hearing aid wearer. So I want to start moving on from kind of the company foundations to how we hear. So I want to kind of set that up. So I think foundationally, this will help with the discussion today, just so everyone's on the same page. Some of you guys may be more familiar with the stuff than others, but I want to make sure that we all kind of have a base level understanding. So this is a picture of the human ear. This is, just to orient you, is the pinna or the cartilage on the outside. And we've got the ear canal itself right over here. You guys can see my mouse, right? Yeah, perfect. So this is the ear canal itself, and then that's going to terminate into the eardrum. You've got the little bones of the ear right there.
Yeah.
And then you've got your cochlea right over here. So those are the peripheral systems that are on the outside of the ear, and what underpins everyone's ability to capture sound in the first place. So sound is going to go in, your ear acts kind of like a funnel, and it captures all of that sound that's going out as pressure waves, as someone's voice is vibrating and causing those, or some kind of sound source is causing that. It's going to get channeled into the ear canal here, hits this eardrum that causes it to vibrate like a drum, thus the name. And then the bones back there, there's three little bones. They're actually the smallest bones in the human body. If you ever have a chance to go to like Body Works in Dallas, they've got some of these, and they fit on your thumbnail. They're really, really small. But they are actually attached to that eardrum. And as that eardrum starts to move, it vibrates those bones, which then moves that vibration over to the cochlea. And the cochlea is that snail-shaped organ there. It's got fluid in it, and that vibration actually disrupts the fluid and causes a wave to kind of travel through there. And that wave stimulates nerves. So I'm sure a lot of folks have heard about like the hairs in their ears, or the sensory cells in their ears. That's what that wave disrupts. And those hairs sit there like seaweed in the sea. And as the sound goes over, it stimulates different frequencies, and that in turn allows us to hear. So that information is then transmitted up to the nerve, which is not depicted here, but there's a little diagram I'll show you guys in a minute that's got that. So when we look at what can cause problems to this system, there's three main types of hearing loss that we normally see. So the first one we're going to cover today is what we call a conductive type hearing loss. That is just a problem with conducting the sound along the pathway, and it's usually some kind of physical impairment. So the majority of those are going to be wax. Wax can be in the ear canal, something to be stopping that ear canal up. I've seen everything from cotton balls to airsoft pellets and little kids as I was screening them, and everything in between, batteries. But there's some kind of obstruction there typically, or less frequently, you can also have a conductive loss by maybe there's a tear in the eardrum. Sometimes with really bad ear infections that can happen, especially in children that are more prone to it. I know for the past few days, it's been so windy here in North Texas that my allergies have kind of been killing me, and that starts to kind of cause inflammation there, and swelling in that eustachian tube area, and then your ear doesn't really drain like it should internally, and that can cause pressure that kind of pushes out on that eardrum and causes those problems. And then we can also see problems with the bones here. So I mentioned otosclerosis previously. That is typically an issue where those bones somehow become fixated due to calcification, and don't vibrate and transmit sound like they used to. So the second and the most common type that we will see, in fact, it's about 90% of the folks that typically will walk into the clinic, it's a sensory neural hearing loss, meaning that all of these structures are fine and they're working the way that they should. But when sound gets to that snail-shaped system, that cochlea, it's typically in those hair cells that we were talking about, like seaweed. Those are not responding like they should. They might be damaged with noise exposure. They might be not there if there's some kind of genetic component to the loss. They might be there, but they're just not responding until sounds get a lot louder and stimulate them. And that starts to cause some distortion effects as well. So that's typically the high frequencies are typically affected most with the sensory neural hearing loss, and that's where you'll see reports of people going, oh, it sounds like I can hear people, but they're mumbling. It sounds like they're mumbling to me, or the clarity's not there anymore. And then the third type is a combination of the two. That's probably the easiest to remember, but some kind of component on both of those systems. So loss of sensitivity in that cochlea, and then also some kind of physical obstruction in the ear canal or the eardrum. So I want to do a little exercise here to try to help you visualize this, because I think a lot of folks, especially when I was working with patients in the clinic, um, they they understood some of the mumbling and things like that they saw as a result of some of these issues, but it was kind of difficult to explain some of the distortion effects that we'll see. So I want to kind of visualize what a word would look like with hearing loss, so that way everyone's kind of on board with that. So here we've got the word toast. That's pretty easy. This is like no problems at all. The word basket, no problems at all. The word table here coming up is a lot smaller. That's going to be more of your visual representation of a conductive loss. That is, the sound is stopped up. There's cotton in the ear canal and the sound's getting through. It's just not coming through as loud as it typically would if that obstruction wasn't there. So it's a little bit smaller. But as we go into those sensory neural losses, remember those are about 90% of the folks that we see, we start to see not only changes in the volume of the sound, so to speak, but also some of the way that the sound's represented from a neurological perspective. So the word washer here is a little bit different, the word coast. And then once we start to kind of combine the two, you start to see these kinds of things. So again, visual representation of how things are represented acoustically to your brain. And then we get some pretty significant distortion here towards the end with the word shoes and then the word lunch. And one of the things I want you guys to kind of think of here is, I bet every one of you could read those words, but it's definitely not as easy as when you first saw toast and basket. Those were, I bet it was almost instantly on sight. You go, I got that word, that's no problem. But as we started to progress through these, it takes a little bit more effort. Now, if you can imagine this visual representation also having a bunch of noise around it, like a Jackson Pollock splatter of stuff around it, it starts to become more and more difficult for the brain to start to separate the information that it's getting as hearing loss is present. So what does that mean? It takes a lot more time, takes a lot more effort to be able to get that same level of understanding that you were getting before. Oops, I hit the wrong button. It went back. So here's a visual representation of what we kind of covered so far. And then this will also show the pathway up the nerve. So you've got sound waves coming in, ears collecting that, hitting that eardrum, vibrating those bones, and then the cochlea's got that yellow nerve attached to it that will send the information up to the brain.
Your brain turns sound into meaning.
Could you hear that sound? I just want to make sure that the sound is shared. Perfect. So the big takeaway with this information is, I want you to understand not only how hearing loss is what type of hearing loss we see and kind of how it presents, but also that your ears and your brain are a system. It's two ears and a brain. That's really, the system that leads to being able to understand and follow things in noise and being able to hear as best you can. So preserving that stuff and supporting that stuff is really paramount. So the types of things that are subjective, that are in control of the listener. So we've got listening effort, we've got focused attention, we've got concentration. These things can fluctuate. So even with hearing instruments, I know a lot of you guys said, hey, I wear hearing instruments currently. There might be days where you go, man, I feel like I was hearing better yesterday than today, or whatever it may be. And it might not be necessarily that something's changed in the instruments or something's changed in your hearing, but your focus might be a little bit less available today, or your concentration. You might have not gotten a lot of sleep. My dog decided to bark at something at 4 in the morning yesterday, or I guess this morning. And so, that stuff is going to affect concentration. It's going to affect your availability to have energy, different things like that throughout the day. So every day is a little bit different. There's some fluctuations as we all go through different things. So getting the most out of your hearing instrument. So I want to touch on that stuff. So we'll go through these pretty quickly since a lot of you guys have hearing instruments. I want you to kind of be aware. So audiogram, how many of you guys have seen one of these before? Hopefully the majority of you. But yeah, I'm sure Dr. Gainey's seen a few. But this is the audiogram. This might not be exactly how it's represented in the clinic whenever it's shown to you, but it's the same type of plotting here. So there's some common sounds that are on here, just so you guys are kind of aware of what everyday sounds go on this. But on the left here, from 0 down to 120, we've got the volume. We call that the SPL level. So the gain in a hearing aid is going to translate to that. So louder it goes as you go down the scale here. And then from left to right, we've got frequency. So you can see that on the bottom axis there. It's going to go through 125 hertz out to 8,000 hertz. Now the ear can certainly hear more than this. We usually test about 250 to 8 because that's where the majority of speech falls in. And in the interest of your sanity of not having to stay in a sound booth for an hour and go through each pitch, we go through the areas where speech is most affected. So the human ear is really good at capturing these sounds here. But you can see as we go over here to that right side of the corner, those consonant sounds, we call them voiceless consonants. That's what really starts to get affected with the sensory neural hearing loss. If you cover your mouth and kind of talk through your shirt or your hand, that's really represents that sound that we would expect as those high frequencies start to kind of diminish over time. So I'd be, aware of the type of audiogram that you've got and aware of your hearing levels on this. And then also, I maintain it, make sure it's up to date. So, Dr. Gainey, how often do you recommend that they come in? Every year, 18 months? What do you guys normally do for follow-ups?
So what we recommend for follow-up care is bringing your hearing aids to us and sending them off for yearly maintenance, because over time, debris, sweat, oil will get inside the hearing aids. They won't be performing up to specs. So when we get it back, your hearing aids are running like the first time you got them. If you're still having difficulty, or your wife's saying, hey, still having some trouble, then we need to do an updated hearing test, okay? We really don't want you to go longer than 3 years for.
And if I'd suggest too, if you find something that's changed, you wake up, and it's way different tomorrow, then certainly go in before that time period. But getting, a consistent measurement on that is really going to make sure that your hearing instruments are doing exactly what you need them to do and making sure that you're getting the most out of them. And then also just at the very least monitoring what you've got. We can never go back and recreate what you had. It's more of understanding where you're at and being able to maximize that moving forward. So if you think of these tests as little data points, that really lets us kind of see the whole history as time unfolds versus guessing where you were a couple years ago if we didn't do a test or something.
Exactly. Always great to get a baseline. And then if you notice any changes, feel plugged, underwater, you get sudden tinnitus or ringing in your ears, absolutely.
So in addition to keeping audio current with hearing within your hearing aids and making sure the prescriptive levels are there, this is probably not a scene that we most of us want to see on the road. But that said, I think it illustrates some of the important factors, the gold standards that are in place, at Dr. Gainey's office and are recommended by the majority of our professional organizations. So the American Academy of Audiology, the American Academy of Doctors of Audiology, and the ASHA group all list this as best practice, but it's verification. We call them real ear measures in the clinic, but the easy way of explaining that is the difference between what the hearing aid says it's doing and what it's actually doing. So that's why this radar gun is there. So your car might say, hey, I'm going 80 miles an hour or 70 miles an hour, whatever it is, but the police officer might have you clocked at a different speed, right? So the timing belt, the physical differences in the car, and what it's telling you might be actually different than what is actually going on. And so just like that, we want to actually measure what the hearing aid is doing. So the hearing aid says that's doing, X, Y, Z. The real ear measure will make sure that that's actually going on. Now, some of the things, in addition to some of the stuff that Dr. Gainey was just talking about, time and wear and tear on the hearing aids can cause those to change. But the other thing is, there's differences in your physical ears. No ear is exactly the same. Your ear canal can be a little bit different than someone else's. And there might be some acoustic stuff that the hearing aid is not necessarily taking into account physically, and that's what a real ear system will do. And it's my understanding you guys do this routinely. Is that correct, Dr. Gainey?
Yes, so
Okay.
absolutely. In Glen Lake's office, we do our real ear measurements. And if you ever feel like, hey, I might need an adjustment or I might need to go check some things, call us, make an appointment. We're happy to reevaluate things because, like Mark said, no ear is the same. And as we age, our ears change in firmness, elasticity, all of that. And it can change in size too.
Yep, for sure. So next, working with your professional. So she's touched on a lot of this, which I think she did an excellent job summing this stuff up. In addition to not only making sure that the audio is giving you what you need and the hearing instruments are doing what they should be doing, making sure that there's any kind of personal adjustments that are in there. So I mentioned no two ears are the same from a physical standpoint, but also your brain. We started with that. Your brain is doing the interpreting of all of this sound, and your brain is very different than anyone else's. So even if you have people that have the same audiogram, the same hearing range that's charted on that graph, there can be differences in what they personally prefer and want. And so that's where working with your audiologist is paramount, and making sure that we're capturing what you specifically need and personalizing that sound. The other thing that she's going to be able to walk you through too is just setting goals. What do you want to accomplish with the hearing instruments? What are you looking to achieve in your daily life? What are some things that you might be pulling away from inadvertently because you're not feeling like you're confident in those areas or hearing your best? All of that stuff is stuff that Dr. Gainey can help you out and the team at Total. But also orientation, learning how to use your device, understanding the parts and just how to maintain it, and how to manipulate whatever you need to do, whether it's volume, whether it's program changes, things like that. Um, Following up, we touched on that. So following up not only initially after the fitting, but also just for those maintenance appointments, like the yearly reviews she was talking about. Great that they do a physical, cleaning and update on all that stuff as well. So the instruments will have at least a 3-year manufacturer warranty. So that will cover any kind of repair issues that you need, even if it's lost. That warranty will cover a replacement one time within there for a deductible. So you got a lot of coverage on these. They're meant to be used. Use that to the fullest, wear them consistently, and you'll see that on here in a minute. The other thing that we can look at too is just assessing outcomes. So this is more subjective in nature of just kind of, hey, where are you still having trouble? What other areas are you looking to, maximize your performance and make sure that we're getting the most out of what you need out of your devices? We talked about maintenance. With summer coming up in Texas, I will tell you that I usually saw an uptick in my men that were outside working just because we sweat. I don't know about y'all, but I sweat a lot. And so going out into the sun is not the best thing for an electronic piece sometimes. That said, the hearing instruments do have a moisture protective coating on them. They are the standard for that is an IPX rating, and so they have an IPX 6.8 rating. Just coincidentally, if you guys are wanting to know that, but what that means is that the test is they get dropped into a meter of water. They sit there for 30 minutes, and when you take them out, they've got to still function. So very, very water resistant. It's a little bit different. I washed my devices the other day. My wife, not on purpose, but they were in my pocket. And my wife grabbed my pants and threw them in the washer, and I heard them clanking around in the dryer. And everything still booted up fine. I do not recommend that routinely for sure. But over time, that moisture protection can break down depending on how much sweat they're exposed to and things like that. So we just want to make sure that those electronic pieces are as protected as possible. If you are a sweater like I am, um, then I would talk to Dr. Gainey and they can get you set up with like a desiccant system just to drop them in there at night or just to keep them working their best and drying out before morning.
All of our patients with the purchase of new hearing aids, because it's Texas, we give them an electronic drying and sanitizing box. It's interesting. There was a fact recently that came out, and that anybody that uses earbuds, that anytime you wear them after an hour of use, it increases your bacteria by 700%. So our drying boxes, not only are they drying boxes, it's not just a desiccant, it's electric, and it has electronic, and it has that blue
USB-C.
light
Yeah.
to
Yeah.
help sanitize.
The
And I
UVC
can't
light.
tell you how many times patients have come in and I look in their ears and there's fungus. So
Yeah.
you got to be careful.
Yep, absolutely. So see, you guys are well ahead of the curve. If you've got that already, again, that's going to be one of those things that just like changing oil in a car will just keep things working as well as they can for as long as they can. They are electronics, and eventually over time, over years, those will start to break down. So again, all of this stuff like the yearly maintenance we've been talking about, and then just the daily or weekly maintenance here will keep them working as good as they can for as long as they can for you. Other than that, the other thing I would do to maximize stuff, there are assistive technologies. So, the doorbell ringer, there's ALDs for that, assistive listening devices. There's TV adapters. So if you're like, hey, I'm hearing well in most places, but the TV might need a little bit of help, or can we do anything about that? There's systems that can kind of spot treat specific areas. The TV adapter, let's talk about that for just a second. For example, the benefit there is it transmits the sound from the TV directly to your hearing instruments. And so you remove all of that acoustic dirt, the lawnmower guys that I was just talking about at the beginning of the talk here. All of that stuff goes away because the sound is no longer traveling through the room, catching all that lawnmower noise and getting into my ear, and then my brain has to take it out. It's going right to your instruments, right to your ears, so you don't have to hear all that acoustic dirt and junk, so to speak. And then finally, there is some oral rehabilitation resources. If you need any of these, please reach out to Dr. Gainey or I, and we can get you over some. They change a lot. There's different apps on the phones and things like that. So I don't like, having links because sometimes those things can change. But the goal of an oral rehab just routine is really to kind of retrain some of those areas in the brain. We talked a little bit about the neurological underpinning for hearing. And being able to kind of strengthen those areas, because at the end of the day, it's a lot like a muscle. Your brain, it needs to be in the habit of processing that sound and making sense of it. And over time, if you've had some hearing loss present, the stats used to tell us that it was about 7 years between when people noticed that there was a problem and then when they would come in and get help. And so in those 7 years, that's a lot of time that sat there, and your brain might not have had that full sound scene. And when you start kind of sending that stuff up those neural pathways again, it takes some time for them to kind of strengthen, just like a muscle would, and get back into the habit of processing that. And then lastly, I touched on this already, but wearing your devices consistently. So just, along that exercise, so to speak, this is very much like exercise for your ears and brain. Keeping those auditory centers in your brain going as strong as possible is really going to pay dividends moving down the line. Coincidentally, we start to see, there was, when I was in clinic, the seminal research for this stuff, it was a guy named Dr. Frank Lin out of Johns Hopkins, but they were looking into a lot of the cognitive processes and things like that are affected by hearing. I think a lot of folks, that made a lot of splashes in the news. So I think a lot of folks have heard that stuff, but as the years have gone by, I think it's been about 13 years now, that body of evidence has just kind of grown, and we start to kind of see this picture unfolding of, we start to see clinically hearing loss affecting those outer ear systems that we started talking about earlier. But over time, because they're not giving all the information to the brain, the auditory centers in the brain, your temporal lobe starts to not being able to respond as well as it needs to address those sounds and to make sense of those sounds. Lots of things go into that. The severity of the hearing loss, the cause of the hearing loss, the neuroplasticity in the person. But the old adage of the sooner that you can get the help and use it or lose it definitely applies to all of this stuff. Some of the things for your communication partners, just to touch on these. I don't know how many times I've talked to, it's usually my men that would come in and just like, well, it's my wife, she mumbles, or the TV can get turned up or whatever it may be. We have pamphlets on this, so if you don't have to take notes on any of this stuff if you don't want, or if you want a more professional pamphlet, I will send those out to the clinic and you can swing by and pick some of those up if you want to kind of pass it on to your significant other or anyone that you were communicating with. But just making sure that they are speaking clearly is going to go a long way for anyone that is wearing hearing instruments. So just making sure they're articulating, that they're speaking at a good cadence, and that you're pausing. I think a lot of the, when we start to speak or get excited, a lot of the words start to jam together. I always think about learning a new language and it feels like it's all just one word in the sentence because there's really no definitive breaks. But just make sure that you're putting those in if you're speaking to anyone that's got a hearing loss. I used to have one patient that was very comfortable letting people know, just like, hey, I've got a hearing loss. Talk to me slowly, look at me, but I know I probably wouldn't be that comfortable saying that to someone, so I know there's some variance there for sure. Talking face to face is a big one. I think that goes without saying in a lot of cases. If your head's in the fridge and someone's trying to talk to you, it's probably not the best time. My wife has a horrible habit of talking to me over the shower door. She's getting ready in the morning and she's saying something and I can hear her saying something, but I can't make it out because the shower's on. So just making sure that you're face to face, you can see the person and there's no other sounds or anything like that going on in the room. Just some other quick ones too. Just if you're out at dinner, trying not to talk with your mouth full, not only for etiquette reasons, but also for enunciation. My a little backstory too on that. My parents-in-law are both clinically deaf. They speak via sign language. And my father-in-law has hearing instruments, just the strongest hearing instruments on the market. It's more for environmental awareness, just because, again, neurologically, he's not had those neural pathways stimulated. But his father, my wife's grandfather, never learned how to sign to communicate with him. And he would smoke a pipe and eat. And I have no idea how my father-in-law lip read him, but he could understand the majority of what was being said despite all of that. But best not to do that, have something in your mouth or look down or away from the person if you're talking to them. Reducing background noise is a big one too in restaurants. I think the restaurant motif these days tends to be that vaulted ceiling without curtains or carpeting or anything like that, and that just really lends itself to a lot of reverberance in the environment. It just makes it more difficult to hear. So questions on any of that stuff? I didn't see any hands or anything like that, but let me know if you guys saw or see any in the chat. So let's say you've done all that. Hey, I've maximized everything I can. I've gone and seen Dr. Gainey, and we've squeezed everything that we can from the current technology I've got. What can I do next? There's certainly advancements in technology. So we recently had a new instrument that came out that has significant advancements. So I want to touch on that today as well for you guys. Before we do that, I want to jump into a quick little video about Eric's Home. We started the video by talking about them. So I just want to kind of show you some of the research that goes on there. Let me see if I can get this other page up here so you guys can see this. Maybe. Whoops, helps so I don't jump to the end of the video.
Welcome to Eric's Home Research Centre. My name is James Hart and I'm the Senior Director here. We actually have around 35 to 40 people working here in Eric's Home. They're all typically based in the buildings just over to my right here. Of those, we have about 20 which are full-time academic staff. We have maybe 10 to 15 PhD students or postdocs working at any given time. And we also have a small team of dedicated clinicians as well as administrative staff here in Eric's Home, which allows us or the rest of the scientific team to focus on the actual scientific work here. Within our scientific staff, we have psychologists, we have neuroscientists, we have engineers, we have mathematicians. all of which contribute to the quite diverse range of science that we actually do. In addition to the scientific diversity, we actually have quite a broad team culturally. We actually have about 14 different nationalities working here in Ericsholm. And as you could imagine, that adds a great deal in terms of sort of the social fabric of the organization, as well as the very diverse professional background that we have. We're actually physically located in Ericsholm about an hour's drive away from headquarters. The decision to keep us separated was actually made right at the beginning of Ericsholm's life back in 1977. The reason for this is we wanted to keep the core research activities that go on here very much separated from the developmental work that goes on in headquarters. Now, why this is a good thing, it means that Ericsholm scientists can actually focus on the next generation of hearing devices, next generation of technology, next generation of features that can go into our devices, completely independently of the development organization. And that's a really good thing, because the reality is in an R&D department, there's a lot of brush fires that need to be put out every day, and there's a lot of immediate concerns. Here we can focus on the important, not on the urgent, and I think that is one of the essence of what Ericsholm is all about. For Oticon, this is also an advantage, because it allows, after an immediate product launch, there's already good ideas waiting in the wings to be able to be included in the next generation devices. So here
I'm
in
going to go ahead and
Ericsholm,
pause that so we don't have to watch the whole thing, but want you guys to get the gist. Really what we're looking at there, and really I think the takeaway is what we kind of touched on earlier as far as just what their focuses are, which I think is really neat. Again, more of that research focus to start with. We've given a name to that research focus. We call it brain hearing. It is a trademarked term. That is Oticon's North Star. That is really a philosophy that says, hey, what do we know about neuro and cognitive science and how it impacts hearing, and how do we capitalize and maximize that for development of research and products. So that's really the goal at the end of the day that we strive for. So you've watched the video, so I'm going to skip over this one just in the interest of time for folks in case they've got other things that they're trying to accomplish today. So what does all that research look like, and how is it culminated currently? Oticon Intent. So that is our current flagship technology that is available. It launched this year. It launched about a couple months before that in Europe. So it's a brand new technology that's got all of the latest research from that Ericsholm team group in there. And the folks that I've seen fit with it have certainly been doing well. So I'm excited about that, certainly. What's new with the Oticon Intent? So we've got some folks that might not have heard this previously, but we about a few years ago were the first manufacturer to represent, or to implement rather, a deep neural network in our hearing instruments. So what does that mean? If you guys have children, I think the easiest way to think of a deep neural network is just to think about how children learn language. The parents have never, or the caregivers have never sat down and formally taught them how to speak or learn any specific language. They do that way later in school after they already know how to speak. That is the same thing as a deep neural network. We're just taking that child example as a biologic one, mimicking a lot of the way that a human would learn something and teaching it to a computer. So in this little graphic here, it's showing a computer learning the difference between a cat and a dog. All of those little data points that you see on those boards are like neural pathways. And those pathways get strengthened as the system learns more and more about how to treat the information it's getting. In our case, the information is sound. So what we're teaching the instrument is being able to identify what's going on in the environment. And then not only that, but how do we weight what's important in the environment? So a seagull on the beach, for instance, is going to be loud compared to the speech that you're trying to hear. And we want you to be able to hear that there's a seagull flying over your head, but we don't want it to overwhelm the person that you're trying to listen to. So that's really the heart and soul of how the sound's processed, is via this deep neural network, or a DNN is what we call it for short, just because that's a lot of words. But The benefit over traditional systems is that it's got a lot more nuance. If you think about learning, that child that learned language organically versus someone that took a class to learn how to speak Spanish or German or whatever it is, that person that took the class is not going to be as proficient, especially right out of the gate, as someone that learned more organically, and that's because of nuance. The idioms of a language, the intonation of a language, different things like that are going to be lost initially until the person kind of seeks that out and learns that, and over time they might get a little bit more proficient. In the hearing aid world, what that really means is the system's a lot better at being able to not just understand what's going on, but to identify it without having strict definitions. Sticking with the four-legged animal theme here, all of these pictures are dogs, and I don't think any one of you is going to look at these pictures and go, I don't know what that is. Even if you can't identify the breed readily, you all know it's a dog. And that is because of your experience. That is because of that nuance that you've got in learning throughout life, and that's giving you the wisdom to know that. Versus a computer system that we have to tell, hey, what is a dog, and define it in a sentence. It might not capture all of the nuance that you see on the screen here. So really that's the benefit of a deep neural network system. So this go around with intent, we launched that a few years ago initially. And with intent, we've got the second generation of deep neural network present in the devices. And really what that means is a lot more understanding in speech, a lot more clarity. And I'll show you some of a quick slide on the research in just a bit. The second big improvement in this instrument in the Oticon Intent series is the inclusion of 4D user intent sensors. So I think it was last year or maybe the year before that during the question and answer period, someone said, what do you think is going to be the new big thing with hearing aids? And I said, I think there's going to be information on how the user is using the information. The hearing aid needs to understand what the user's intentions are. And really, here we are. I didn't even know this was coming, but that is where the name intent comes from. But these 4D sensors are used to identify what an individual is doing in a certain situation and be able to make adjustments to their prescriptive levels and their hearing accordingly. And at the end of the day, when you put all that stuff together, really what you get is this idea of precision medicine. So I had a family member that was pre-diabetic for a while and was doing like the sugar blood strips to monitor her blood sugar. And she would do that twice a day, maybe 3 times a day. But just like the hearing test we were talking about, those are those data points, right? Versus nowadays, there are systems on the market for diabetics that can attach to your arm or your hip, and they will monitor in real time what type of dose of insulin that the person needs to be able to adjust that. So no longer is it just this general dosage based on age or weight, but also, but this is taking into account the actual individual's needs in any given moment in real time. Same kind of concept here that we're talking about with hearing instruments. How do we know it's working? How do we know it's beneficial? So the research that was done in Eric's home after the launch showed a 12% improvement over our previous product with just the DNN, and then a 35% improvement over our previous product with the DNN and the sensors both active. Now that 35% and that 12% respectively might not look like a lot here, but this is on what we call a speech intelligibility index curve, and that curve goes up kind of exponentially in the middle. And really what we're looking at with that 12% alone is about a 60% understanding or comprehension benefit. So whereas someone might have gotten, let's say, 10% before, you're now able to, by proxy of just the DNN alone, provide about a 70% overall comprehension in a noisy environment. So I think that's pretty significant. I think that's pretty neat. Oticon is never going to launch a product that we do user and wearer surveys constantly whenever there's new products that are on the verge of being rolled out. And the threshold for whether we decide it's worth it or not to upgrade and to pursue developing the product is 80% of the people that are experienced wearers need to go, yes, this is a significant improvement, and yes, this is better than what I'm currently got. If it doesn't meet that threshold, it goes back to the drawing board, and we wait until there's better technology to put in there or different technology that would support more. So that is Oticon intent in a nutshell. There are some other benefits as far as the comfort. The receiver is different. That's the little speaker that goes into your ear. There is a new wireless standard that is future-proofed Bluetooth LE audio that will, it's going to allow, that's a pretty new technology that's rolling out over the last year, but in the coming years, that's going to be really the standard for computers and TVs and airport lounges and things like that. So the goal is to be able to have the instrument be able to connect to those systems seamlessly, and then you can get the announcements, if you so desire, right into your hearing instruments, again, cleaning up that signal dramatically. So questions on any of that stuff? That's a lot of concepts to kind of run through in a few slides. Is anything clear as mud?
We love questions, so y'all shout out, ask them. We've got here, when I walk into a restaurant or large meeting, I'm removing my hearing aids, can't hear with them in. What can I do? Ooh.
Yeah. So those are, so yeah, you want to take it?
Oh, yeah, for sure. We need to go ahead and get you an appointment. Because we need to look at your file. We need to look and see if you've had a hearing test recently. But yeah, absolutely. Go ahead, Mark. What were you gonna say?
Oh no, I was going to agree. I was going to say they, I would, if you haven't done that hearing test we talked about earlier, I'd check that. I'd make sure the settings are good, make sure physically the device, all that stuff that we talked about kind of in the beginning. I would certainly get an appointment and they can run through all that with you and make sure that the devices are in spec and working as well as they can for you to be able to help with that.
And there might need to be, that might all be okay, and we need an extra accessory that might work better for you or fix the problem. I mean, there's lots of remote mics and accessories that can help you.
Yep. Yeah, it's so this is such an individualized thing that's really the important part is that these are not, I think some of my patients that would come in would think it's, pull it off the shelf and put it on this person's head, and that's just not how it works. And so coming in and letting her know those kinds of things is exactly what's going to help address those concerns.
And I don't see your name in our system, but if you want to, I'll put our number in the chat box so we can make sure, because you might have gotten your hearing aids elsewhere. So we're happy to help in that situation.
That's another thing. I used to see people that were at different clinics sometimes, and it was just as simple as making a, either a cleaning or a dome change, which is just that coupler to your ear. Just things like that can make a big difference depending on the type of loss and all the stuff that's going on. So, yep, I think the easy answer or the straightforward answer there is just I would get an appointment on the books for sure to take a look at that.
Yeah, absolutely. Alan said got an opposite thing going on. Whenever he walks into a restaurant, he turns the volume to the max to use speech and noise program, but still having some trouble hearing people across the table.
Yeah.
The remote microphone thing as well.
Remote mic, so along the same concepts we were talking about with the TV, what the remote mic does is it takes that person's voice right to your ear, so it gets rid of that acoustic dirt and helps again give you the best shot. Now there's certainly restaurants that I've been in that forget it. It's just, I'm lucky that my wife taught me a little bit of signs so we can communicate sometimes, but that said, if you're noticing it constantly or concerned about it, then there's certainly things that we can do to address that. But ideally, you'd be able to keep your instruments on. So, I never want them to be so much that you're so overwhelmed that you're pulling them out. We want them to be comfortable enough that you're getting benefit and being able to wear them regardless of the situation. So, yep.
We have another question. When was the intent technology first sold?
So February this year in the US. It was December or late November for Europe.
So wait, Europe gets it before us?
It depends. For the previous product, the US was the first place, but I don't know. That is other people that make those decisions, but no, for the intent, it launched in Europe and then over here, and then it's just recently rolled out for our veterans as well.
And Jane, call Brittany and talk to her for me, okay, Jane? Just a little now.
Okay.
All right.
Yeah, and if you're a big thing too, if you're ever curious about would that technology benefit me, and you're thinking about that, reach out to Total Hearing Care, and they can get you set up either with an in-office demonstration so you can hear what that sounds like. I think that's really helps to disambiguate a lot of that stuff. They say pictures are worth 1,000 words. I think being able to hear in there is a big benefit as well.
And we're out of our loaners, but if you call up here, we can get you scheduled to get some loaners once we get them in. They're being borrowed by other patients. So absolutely.
So real quick to sum up then, so hearing loss is the third biggest public health issue. So estimates are about 40 million Americans are affected by it. And the issues are that it takes so much work if you're not hearing your best with or without hearing instruments to be able to communicate. And that's really where the problems come in. I mentioned that work with Frank Lin, that subsequent research that's been done shows links to hearing issues and all of these different comorbidities. But in addition to that, I think probably the one that gets overlooked the most are the social aspects. And so this is really research that was done more with a broad scope of like, hey, how do we age as gracefully as possible and maximize everything that we've got as we get older? And the hearing instruments right there in that communication, that purple square is really what we're looking at. So, I mentioned my mother-in-law and my father-in-law both having significant hearing loss and communicating via sign. Even though we understand that and can communicate with them via sign, sometimes at get-togethers or holidays and things like that, I can certainly see the frustration and isolation on my mother-in-law's face. And so that's certainly something to not lose sight of over time with this stuff. That's the important part, right? Is being able to connect with the people you want and share ideas and talk with your loved ones. So again, that concept of brain hearing is really the underpinning philosophy for all of this stuff and what guides our decision-making processes as a company, which is exciting for me. I really enjoy that. And then understanding speech better is really the goal. So all of this stuff is really what we're aiming for with your current hearing instruments and maximizing what you got there, or being able to support you with an assistive device if that's something that can help you, or new technology as well. The new technology, I mean, think of that stuff as a new surgery option or a new medical option or whatever it may be. It's not just new for new's sake. It's the way that it's treating the sound and addressing the sound is going to be providing your brain better support via sound resolution and a lot of the other things that go into that. So that's really the goal, is if that's something that you feel could benefit you, and if you're struggling with all that other stuff, then certainly I would explore all your options. If there's any other questions, please let me know. If not, that's all I've got for today. I think we're right about we're right about an hour. I wanted to leave about 15 minutes for questions and anything that Dr. Gainey needed to get to.
Yeah, go ahead and ask away. Y'all can talk or y'all can write them in the chat box.
And let me get this out over here so I can see you guys. There we go.
All right.
Carrie, I love that bookshelf behind you. I'm jealous. I would love a bookshelf like that, or a room with a big bookshelf like that.
Yeah, that looks cool. Okay, we have an announcement for our winner. And they told me, and I forgot who it was. So, Kiki, you have to write it down for me, or the choices are an Amazon card or a Starbucks card. But who was the winner?
Mary Snyder.
Okay, great. Yes, thank you. That's yay, Mary Snyder. Yay,
Congratulations.
Congratulations, Mary.
All right, Mary, just call our office 214-987-4114. I'll say it again, and I'll put it in the, oh, you got it? Perfect. I'll put it in the chat box again too. That's 214-987-4114, and just let us know which one you want, the Starbucks, or sorry, Amazon or the Starbucks. Okay. Thank you everybody for attending. Mark, thank you for being a guest speaker. We really appreciate it. And I've got those names written down for the 2024 drawing for a free hearing aid. We have a big bowl of names, and Kiki's going to be in charge of counting out all the votes. So And we'll announce that winner in 20.
Fingers crossed. Good luck, everyone. And thanks for your time and your patience today. Have a fantastic rest of the day.
Thanks, Mark. Thanks, everybody.
Yeah.